Acid reflux is a common condition that features a burning pain, known as heartburn, in the lower chest area. It happens when stomach acid flows back up into the food pipe. And meanwhile, gastroesophageal reflux disease, or GERD, is diagnosed when acid reflux occurs more than twice a week. Exact figures vary, but diseases resulting from acid reflux are the most common gut complaints seen by hospital departments in the United States. The American College of Gastroenterology says that over 60 million Americans experience heartburn at least once a month, and at least 15 million as often as daily. GERD is most common in Western countries, affecting an estimated 20 to 30% of the population. Before we dive deeper into this topic, I would like to share with you an important video on how to eliminate your acid reflux in 5 minutes, using only 3 ingredients you already have in your kitchen. You may watch the video by following the link in the description below. Heartburn happens because stomach acid becomes backed up in the esophagus, which moves food from your mouth to your stomach. The burning sensation is usually the result of stomach acid leaking up into the esophagus, through a flaw in a valve known as the lower esophageal sphincter, or LES, which connects the esophagus and the stomach. When the LES doesn't tighten properly or becomes weakened, stomach acid can flow back into the esophagus, causing a burning feeling. Many things can trigger heartburn. The most common cause is food that's acidic or high in fat, like citrus fruits, tomatoes, onions, chocolate, coffee, cheese, and peppermint. Spicy foods or large meals can also be the root of distress. Other sources of heartburn include aspirin or ibuprofen, as well as some sedatives and blood pressure medications. Tobacco in cigarettes is known to affect LES function too. Cigarette smoking relaxes the muscle, which can result in heartburn. Being overweight or pregnant can also trigger heartburn due to added pressure on the abdomen and stomach. When stomach contents repeatedly back up into your esophagus, it can cause a variety of symptoms. Symptoms depend on what organs are affected by the stomach acid. Not everyone with acid reflux will have the same symptoms, and it can range from mild to severe. Reflux symptoms are more common when lying down or bending over, after a heavy meal, and after a fatty or spicy meal. Acid reflux can occur at any time of day. However, most people tend to experience symptoms at night. This is because lying down makes it easier for acid to move up into the chest. Heartburn is the most common symptom of acid reflux. Your stomach is protected from the corrosive effects of stomach acid. If your lower esophageal sphincter doesn't prevent your stomach acid from leaking out of your stomach and into your esophagus, you will experience a painful burning sensation in your chest. Heartburn can range from uncomfortable to painful. However, the severity of the burning sensation doesn't necessarily indicate lasting or permanent injury to the esophagus. If the backwash of stomach acid rises all the way to the back of your throat or your mouth, it can cause a sour or bitter taste in your mouth. You may also have a burning sensation in your throat and mouth. Some people experience regurgitation. This is the feeling of liquid food or bile moving up your throat rather than down. In some cases, people may even vomit. However, vomiting is rare in adults. Infants and children with gastroesophageal reflux may experience repeated regurgitation. This can be harmless and perfectly natural in infants under 18 months old. According to the National Digestive Diseases Information Clearinghouse, about half of all infants experience reflux in the first 3 months of life. Dyspepsia is a burning feeling and discomfort in the upper middle part of your stomach. It's known as indigestion. Heartburn can be a symptom of dyspepsia. The pain can be intermittent. Some people with dyspepsia may feel bloated, have heartburn, feel uncomfortably full, be nauseated, have an upset stomach, and vomit or burp a lot. These symptoms should be taken seriously. They can potentially signify the presence of another disorder, called peptic ulcer disease. Such ulcers cause their own chronic symptoms and can bleed on occasion. In a few cases, if left untreated, they can burrow all the way through the stomach, leading to a medical emergency called perforation. Difficulty swallowing, or dysphagia, affects at least 1 in 25 adults every year. This is a condition in which swallowing is difficult or painful. There are many potential causes of dysphagia. In addition to GERD, it can be caused by stroke, multiple sclerosis, Parkinson's disease, or cancer. Acid reflux can irritate the throat. Common symptoms include sore throat, hoarse voice, and the sensation of a lump in your throat. Some adults and most children under age 12 with GERD don't experience heartburn, which is the most common symptom of acid reflux. Instead, they experience other reflux symptoms. Dry cough is a common symptom of reflux in children and adults. Adults may also experience the sensation of having a lump in the throat. They may feel like they need to repeatedly cough or clear their throat. Reflux often exacerbates asthma symptoms in children and adults. Symptoms such as wheezing are worsened by stomach acid irritating the airways. GERD isn't life-threatening or dangerous in itself. But long-term GERD can lead to more serious health problems. We have a video that will tell you about 6 serious consequences of acid reflux or GERD, and you can check it in the description below. To manage and relieve symptoms of acid reflux and GERD, your doctor might encourage you to make certain lifestyle changes, like maintaining a moderate weight, quitting smoking if you smoke, avoiding heavy meals in the evening, waiting a few hours after eating to lie down, and elevating your head during sleep by raising the head of your bed 6 to 8 inches. Your doctor might also suggest taking over-the-counter medications, like we listed here. All of these medications can cause side effects, so talk with your doctor about which option is the best for you. Antacids like Tums are typically used for occasional and mild symptoms of acid reflux and GERD. But if you find that you're taking antacids almost every day, you may need a stronger medication. H2 blockers like Pepcid AC work to lower the amount of acid your stomach makes. Many H2 blockers are available over the counter, while higher doses of these medicines can also be prescribed. PPIs like Prilosec also lower the amount of acid your stomach makes. Because they tend to work better than H2 blockers, they're more helpful when it comes to healing the esophageal lining, which can become damaged when someone is dealing with GERD for a while. Like H2 blockers, you can buy some PPIs over the counter, and your doctor can also prescribe you a higher dose. Some individuals might prefer to start with home remedies to treat their heartburn. In the short video that I share in the description below, I will tell you about the 6 fatal consequences of acid reflux and GERD, and how to defeat these deadly diseases, using the simple home remedy I'm about to give you. It only takes 5 minutes to make the remedy, so you can enjoy your first sip within minutes from now, and be instantly heartburn-free forever. You must watch this short video now, as you may not get a second chance. So, click the link in the description below to watch now.